Right, thank you, Mr. Moderator. So basically, our country is still new with the SSB tax implementation, and the tax is seen as an upstream approach by the public health in order to achieve the objective, which is to reduce sugar consumption by our society. And the upstream approach is basically an intervention that involves the policy and regulation approach that have the potential to affect larger populations through regulation and uh, thus will cause the increase in access towards the public to ensure their better understanding in the reason of the sugar and in the okay. Thank you, Mr. Moderator. So basically, SSB tax is seen as an upstream approach in public health, and our country is still new with the SSB tax implementation, which the objective is to reduce sugar consumption among society. So the implementation of the tax is seen as an upstream intervention which involve policy approaches that have the potential to affect large populations through regulation, increasing access to the public, or economic incentives. Thus, will have the midstream interventions to happen indirectly within organizations such as worksites and also hospital and also clinic, and thus will have the effect towards the downstream interventions, which are the individual themselves. So when they have the better understanding and also they know the sugar is the root cause of a lot of problems such as obesity, diabetes, and including oral diseases such as caries and periodontal diseases, and etc. Therefore, they have the ability to control and to make the healthier choice which contain much less sugar. The implementation of the tax basically build the healthy public policy, which is the policy can make the healthier choice as an easier choice for the public. So either the products that contains much less sugar could be cheaper and much more easy to access rather than the unhealthy choice. So the implementation of the tax basically focusing into four aspects, which is first is the government aspect. So the approach by the government by the implementation of the tax in public health, it will enhance the educational activities and nutrition promotion for the public, and this includes the implementation of healthy cafeteria, nutrition information center at community, and individuals themselves. So the resolution is the public will have the better education and health promotion easily accessible towards them. And also our country could have the stronger legislation and regulation of industry, and the taxation of sugar could be in general or specifically to the beverages that is highly consumed by our society. And this can also improve the food supply and food environment to have the better food culture and healthy lifestyle. So next aspect is industry. So the approach by the industry is highly influential as they influence the public through the campaigns. The campaigns are made through the social medias as the technology and in advancement of our current era. The campaigns should be implemented in much more creative ways, and new ideas should be introduced by these industries as they have the better understanding of the importance in supporting the government policy of the implementation of the tax. They can continue and even increase the action in promoting and advertising or even marketing their products in a healthy way, so that the healthy choice can become a new culture and also a new trend in our society. So the industry need to understand that they have an important role to play in public health education themselves. Okay. And then the next aspect is the society. So the society approach involve a lot of agencies and also society society um, um, can involve the approach in the a lot of levels and also a lot of community groups. For example, school, hospital, clinic, surau or masjid, or any organization in Malaysia. So the caterers or the food providers should have the better understanding in the role of sugar in their diet and have the good and healthier food preparation with less sugar in any events that they conduct. And also the SSB drink machine should be banned in these public places such as school, clinic, hospital, and etc. So in order to support the government effort and also the government action to implement the tax, which shows that they understand why the tax is implemented. And obesity prevention program and also nutrition promotion activities can also be made in this organization, such as in schools, in clinic, or in their company, so that they have the cultural and also attitude change towards the better health policy in their places. And last aspect is the downstream effect that occurs indirectly by the implementation of the tax. Thus, the tax will involve the individual in educational activities as they understand the role of the sugar and how their lifestyle affect their life in future. And this can also cause the individual to have the ability to make better choice and also to expend their money for the better food and drinks with less sugar. And the individuals are able to take the early preventions to early preventions, such as in their younger children, especially to educate their children to take the drinks or food that is much healthier and contains natural sugar, such as honey, fruits, and vegetables, and to avoid taking the sugar sweetened beverages. Okay, so therefore we can see as the conclusion that our policy plays an important role as the hard policy to effect and to influence the mindset of our community and public to have the better understanding in achieving the objective to reduce sugar consumption. Therefore, that's all from me. Thank you, Mr. Moderator.